Hi, my name is Erica Shiles, and I voluntarily give Maryville University permission to record my image and/or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any other devices as soon as it has been reviewed and graded by the instructor.
Hi, I'm gonna wash my hands with hand sanitizer, and the door is shut. My name is Joan and I'm gonna be doing your head, ear, eye, nose, and throat assessment today. Can you tell me your name and date of birth?
Erica Shiles, 1980.
Okay, thank you. Okay, I'm gonna start with your head. Right now, just looking at your head, I can see that your head is symmetrical. The contour is regular. And I'm gonna palpate for lumps, no lumps. You feel any tenderness? Okay. And your hair is well distributed. And also, I'm gonna inspect your face. Can you smile? Okay. Your face is symmetrical. No lesions, no masses, no edema, and no involuntary muscle movement of your face. And now I'm gonna go to your eyes. I'm gonna look at your eyebrows. They are well aligned. The hair distribution is equal in both sides and symmetrical. Your eyelids, they're also symmetrical. And your eyelashes, they are pointing out. They're not pointing inwards. And I'm gonna look at your conjunctiva. It's pink. No redness, and it's also moist. Your sclera is white, and your pupils and cornea, they're round and regular, and your pupils are around 2 millimeters both sides. And now I'm gonna test for your vision acuity by using the modified Snellen test. And I'm gonna stand 6 feet away. I need you to cover one eye and read. Which line can you read the smallest?
LTFPH.
Okay, that is 20/20 vision, which means you can read what most people can read at 20 feet away. And what colors can you see?
Red and green.
Okay, perfect. Good. And now I'm gonna look at your inner eye using the optometry, and I'm gonna use my thumb to adjust. And I'm gonna stand about 30 centimeters away, and I'm gonna start looking at your eye. Let me see if the light is on. Yeah, light is on. And I'm looking at your right eye with my right hand and my right eye. Now I can see your red reflexes. And, I can see your optic disc and also your retina and also the blood vessels. They all look healthy. And I can't do it. I'm sorry.
Keep doing it, go.
Okay, and then now I'm gonna look at your peripheral. I'm gonna shine light in your eyes to assess for visual acuity, pupils dilation. to see if they direct and consensual reaction to you. So right now I'm shining your eye in this one. I can see it's constricting, and then I'm looking at the other eye. Yeah, it's also consensually reacting. Okay, now I'm gonna test your peripheral vision. I'm gonna have you cover your left eye, and I'm gonna also cover my left eye, my right eye. Is it?
Yeah, you can do that.
Yeah, and then I'm gonna tell me when you see the object.
No.
Okay, so now this depends on my visual. If my visual is good, then I think I can say that's a good test results. Peripheral vision. And now I'm gonna test for extraocular eye movement. And this is testing cranial nerves 3, 4, and 6. I'm gonna have you follow the object. I'm gonna go just with your eyes. And then I'm gonna see if you can accommodate and converges. Okay. All right. Everything is intact. Now, no nystagmus, no lead lack.
Okay.
Nose. I'm gonna look at your nose. Your nose, just looking at it, is no deviation. It looks symmetrical, and I don't see any obstruction. Can you try to blow out? No obstruction. And then I'm gonna use the optometry. Oh, I'm gonna use the otoscope to look at your nose.
Pencil.
Huh?
Are we supposed to do a pencil?
No, it's yeah. Okay. Looking at your nose, I see they're pink. There's some hair, pink and moist. No drainage, no lesions, no masses, and no inflammation. Okay. And then your septum is also intact, not perforated. Okay. And now I'm gonna check your cranial nerve 1 olfactory by having you smell that.
Baby powder.
Okay. Thank you. It's intact. And then I'm gonna check your frontal and maxillary sinuses. Do you feel any tenderness? Okay, good. All right, now I'm gonna check your ears. I'm gonna start with, I'm gonna inspect your ears, both ears, the auricles, they're symmetrical, no deformity, no lesions, no masses, and they also what do you call it?
Regular.
They're regular. And then no redness, no, I'm gonna look inside, no drainage. Now I'm gonna look with the otoscope. I'm gonna pull your ear up and back. And then I can see the canal, no drainage. There's just a little bit of cerumen, and I can see your tympanic membrane is palish gray, and no inflammation, no bulging. And now I'm gonna test for your hearing using the Weber test. I'm gonna strike this and place it on your head. Tell me when you can stop hearing it. If you can hear it in both ears.
I can hear both ears equally.
Okay, okay. And then now I'm gonna do the Renee test. I'm gonna strike it, the tuning fork, and I'm gonna put it behind your back on the bone, and then tell me when you can stop hearing it.
Now.
Okay, now I'm gonna place it in front of your ear. Tell me when you stop hearing it. And I'm looking at the clock.
Now.
Okay, so the Renee test is indicating that your air conduction is longer than the bone conduction, which is normal. The ratio has to be 2-to-1 ratio. So your hearing is intact. And now I'm gonna do your whisper test. I'm gonna come behind you. I want you to repeat what I'm gonna say, but close your other ear. Snake.
Snake.
Okay, that's good. Thank you. And now I'm gonna look at your mouth, your lips. They're symmetrical. If you can cleanse your mouth, yeah. Facial cranial nerve number 7 is intact. If you can, your lips are moist, no cracks, and no lesions. If you can open your mouth, and I'm gonna, okay, can you lift your tongue up for me? And everything looks good, no lesions, no whiteness, pink and moist. And also, can you stick your tongue out? Okay, yeah, your tongue is well, the texture is appropriate. And I'm gonna use this, I'm gonna use the tongue blade to look at the back of your eye, of your throat. And I'm also lifting on the side of your tongue. Okay. And can you say ah? Okay. Yeah, everything looks intact. No exudate. Your tonsils are not visible. Everything looks pink and moist. No variations in color. No inflammation. No bleeding. Even your gums, they're intact. No bleeding. And I think everything looks good. So now I'm gonna look at your neck. Your neck looks in front here, everything looks symmetrical. And I'm gonna stand here. I'm gonna check your trachea. The trachea is in midline. I'm gonna palpate your thyroid. It's not palpable, which is good. And your neck, no scars, no lesions, no redness. The skin is good color. And I'm gonna check your lymph nodes up here, all over your neck. Okay. Okay. No lumps noted. Everything looks good. Okay. Thank you.